Alzheimer's disease is the commonest form of dementia, and there are challenges to make the diagnosis of Alzheimer's disease early. Standard MRI has diagnostic value in the latest stages of Alzheimer's disease, but the earliest stages of the diagnosis mostly rely on biomarker investigations such as amyloid and tau. In a study that is funded by the UK Medical Research Council, we study patients with symptomatic early Alzheimer's disease with evidence of amyloid with or without tau in the cerebrospinal fluid and no evidence of neurodegeneration on their standard MRI. We aim to assess if we can find an early imaging marker for the diagnosis of Alzheimer's disease at the early stages of the disease by using the ultra-high field MRI at 7T. 7 Tesla MRI has the capacity to show magnified views of brain structures, including the areas that are relevant to Alzheimer's disease, such as hippocampus and hippocampal subfields. We have found that subtle but specific changes in the cognitive memory in our study participants correlates with subtle loss of volume in the hippocampus and its subfields. Also, subtle changes in the quantitative susceptibility mapping, which is reflective of ion accumulation within the hippocampal subfields, correlates with specific cognitive impairment. It's important to mention that these patients in our cohort did not have reported hippocampal or medial temporal lobe atrophy on their clinical MRI at 3 Tesla. In addition, we have found that the loss of volume in hippocampal subfield correlates with abnormal level of amyloid beta 42/40 ratio in the cerebrospinal fluid. Our preliminary results show that there is a linear relationship between the volume loss of hippocampal subfield and the CSF amyloid. Though this needs to be tested in a larger cohort, this finding implies that 7 Tesla MRI may have a biomarker utility as a proxy indicator of amyloid abnormality in Alzheimer's disease. Further applications of 7 Tesla MRI will be in a study of brain functions and brain structures after COVID-19 in order to study potential precursors of Alzheimer's disease after COVID. In a UK-USA collaborative study funded by the NIH, the 70 COVID Consortium, we are looking at the structural imaging at 7 Tesla in patients who had mild to severe COVID-19 more than 6 months previously, and we compare them with healthy controls. So far, we have seen subtle changes within the hippocampus and hippocampal subfields in patients who were admitted to intensive care unit due to severe COVID more than 6 months previously. But those changes were not observed in healthy controls or those who had previous mild COVID illness. We need larger number of study participants, longer term follow-up, analyzing genetic and comorbidity data and plasma biomarkers from patients who had COVID and those who had non-COVID illnesses, such as illnesses with other respiratory viruses, to better understand the precursors of cognitive decline after severe COVID and their clinical outcome. In summary, we want to utilize ultra-high field MRI at 7 Tesla to improve early diagnosis of neurodegeneration and the clinical applications of 7 Tesla MRI to better understand the causes of cognitive decline. More details of our findings are reported in the abstracts and presentations at the Alzheimer's Association International Conference in Amsterdam.